Uh, Good afternoon, students. My name is Professor Pechinak. Today I will read you lecture. The title of it is Clinical Sciences of Diseases of Cardiovascular System in Children, Semiotics of Congenital and Acquired Diseases of Cardiovascular System in Children, Characteristic of ECG and ECG in healthy children of various ages. The clinical examination of cardiovascular system comprises complaints, anamnesis morbi, anamnesis vitae, and the examination of the patient using palpation, percussion, auscultation, and management of arterial pressure and additional methods of investigation. If doctor suspects the cardiovascular disease in children, he has to pay attention to fatigue upon the physical exercises, dyspnea at rest or its movement, edema, cyanosis, paleness, palpitation, head aches, heart aches, dizziness, nausea, vomiting, abrupt syncope, and delayed physical development. If doctor suspects the cardiovascular diseases in infant, he has to pay attention to sudden cry, anxiety, impaired breastfeeding, episode of dyspnea and cyanosis or skin paleness, and increasing sweating, sometimes with or without elevated of the body temperature. Very important is analysis the amnesis morbi. So the patient, the doctor has to ask patient or his relatives the questions when did the first signs of the disease appear, the dynamic of the disease since its onset, additional symptoms, previous examination and treatment, and medication used, duration and efficacy, where was the child examined earlier, and analyzes the result of examination. A very important part of the clinical examination is the analysis of anamnesis vitae, because the current pathology may be associated with obstetric history of the child, and so we have to analyze the obstetric history, medical history of the child, very important, the family history and social history of the child. General examination begins from the analysis of consciousness, severity of the state, response to environment, posture of the patient in bed, physical and mental development, strictness of dysembryogenesis, analyzes the color of the skin, edema or pastosity, and inspection of the neck, heart area, and limbs. Then doctor, as a rule, uses the methods of palpation, percussion, auscultation. As a rule, they measure the arterial blood pressure, and for diagnosis used the additional methods of investigation. With the help of palpation, doctor determines the upper beats and the heartbeat, arterial pulse, and cat's paw symptoms. And the features of apex beat are follows. Location, it depends of the age of the child, width, area, amplitude, power. And the reason was the displacement of upper beaks, upward, downward, to the left and to the right, can be cardiac and extracardiac. And cardiac beat also cardiac beat also doctor have to investigate it and correspond to the size of the ventricles, and mostly it this is a power which or resistance of the chest, which pressure of the heartbeat into the hands of the doctor. The next parameter which we determine according to the palpation is a pulse. It can be synchronism on both radial artery. Then we detected the pulse rate, rhythmicity, the pulse strength, the pulse volume, and pulse amplitude. As a rule, the pulse rate coincides to the heart rate, and you have to learn it during your practical studies. Using the palpation, we also detected the cut spur, and it can be systolic and diastolic. Systolic cut spur is detected in the second intercostal to the right from the sternum in aorta stenosis and coincides with the apex beat and jugular pulsation. And diastolic cause beat is detected in apex of heart or in mitral stenosis and does not coincide with apex beat and jugular pulsation. Percussion of the heart allows to assess the heart size, configuration, heart position, width of the vascular bundle, and performed in supine position. There are several techniques of the heart percussion, and they are direct and indirect. And on this slide, you can see that how to do direct and indirect percussion. There are several rules of the heart percussion. The first, the relative borders of heart should be assessed by light percussion. The heart percussion should be performed along the intercostals in direction from the lungs to the heart. The relative borders of the heart is assessed by external edge of the finger, and at first we determine the right border, then the left, and then the upper border. And when the right border of the heart is assessed, the height of diaphragm should be determined. And several causes of displacement of the relative borders of the heart are evident to the left, to the right, upward, and to all sides. And it can be cardiac causes and extracardiac causes. In the heart auscultation, so there are several rules for auscultation of the heart. At first, the first point, we can hear the sound from the mitral valve. This is a region of apical impulse. Then the second point, the second sound from the aorta valves. The second right intercostal space close to the right edge of the sternum. The third point, sound from the valves of pulmonary artery. Second left intercostal space close to the left edge of the sternum. Fourth point, sound from the tricuspid valve. And the last 5-point Botkin's air point, the sound from all valves. And on the slide, you can see the projection of the heart valves into the chest. And this is also on this slide, you can see the procedure of heart auscultation. So the first point, the second point, the third, the fourth, and the fifth point. And using the heart auscultation, we, as a rule, heard the tones of the heart. The first tone, it has two components, the valve component and the muscular component, and it's systolic. And the second tone, diastolic, has only a valve component. And we auscultate the heart in 5 points. So heart auscultation of the first tone and the second tone is heard in 5 tones, in 5 points. But only tone second is analyzed in 3 points at the point number 2, number 3, and number 5. Sometimes we hear the third tone. It is a component of tone 1. It's vascular tone and may be associated with physiological or pathological status of the child. And sometimes we hear the tone 4. We name it diastolic gallop, and may be detected only in pathological states. And heart murmurs. Also, we heard, sometimes we heard in child's heart. It can be organic, associated with anatomical defect or abnormalities, and functional in absence of anatomical defects. And functional murmurs, as a rule, have low intensity and instability, change of the quality with change in child position, in breathing, localization within the heart boundaries, heart had better in supine position, and functional murmurs are always systolic. And causes of the functional murmurs are following: the fever of infections, genesis, anemia, nervous stress, decreased blood viscosity, myocarditis, and in developing heart. Enterogenic murmur usually are heard in a patient with cardiovascular pathology. It has high intensity, stability, increased with change position in body and with physical activity, no change with breathing, extension over heart boundaries, and heard both in systole and diastole. And pericardial murmur also we can hear in pericarditis. It enhanced with stethoscope is pressed into the body in sitting position when the body is bent forward, and decreased in supine position, and localization within the heart boundaries. And additional methods of investigation. One of them is electrocardiography, the method of graphic registration of electric events originating in heart muscles in the course of the heart cycle. And using electrocardiogram, we can diagnose the impaired of the rhythm of the heart and conduction, hypertrophy of the chambers of the heart, and different diseases of the heart. And on this picture, you can see the normal rhythms and different impairment of the rhythm of the heart. And electrocardiography, we measure in supine position on empty stomach and in 2 hours after the meal. And there are 12 conventional leads of electrocardiogram, 3 standard, 3 augment limb leads, and unipolar precardial leads. Usually, electrocardiogram velocity of electrocardiogram trace is 50 millimeters per second. There are several elements of a normal electrocardiogram. 6 waves, 6 intervals, and 2 complexes. When electrocardiogram is assessed, the following is taken into account: the presence of the elements, their duration, amplitude of waves, their shape, and direction of waves relative to either electric line. And on this picture, you can see the waves of electrocardiogram. And next picture, you can see the intervals of electrocardiogram. And you have to know that electrocardiogram change with the age. And here is the peculiarity of electrocardiogram in newborns, in infants, in young children, in the children of preschool age, and in school children. At this age, electrocardiogram is about the same as in adult. And now several words about echocardiography, where we used to investigate when we used to investigate morphology, kinetics, the state of the hemodynamic, the parameters of the chambers of the heart, the state and functional performance of the valves of the heart, the state of the myocardium, and others. And indication for echocardiography are several. First of all, we have to investigate the heart and diagnosis of congenital and acquired heart defects, and when the child has heartache and heart murmurs, arterial hypertension, cardiomyopathy, and other defects or other diseases. When child has other diseases, we use the echocardiography. And also the parameters of echocardiography change in newborns and change with the age. And so you can see the parameters of echocardiography in adolescence. And another method of investigation, Dopplerography of blood vessels using ultrasound. Then we also, for investigation, use X-ray imaging of the chest, tomography, also X-ray imaging of the heart, angiography, also the method of X-ray examination of the heart cavities. Then coronarography is an X-ray contrast study for diagnostic ischemic heart diseases. Using Holter monitoring, we can control of the heart activity of the child. Using the methods of sphingography with gamma camera, we can study the cardiac hemodynamics and contractile functions of the heart. Then in intensive care department, as a rule, we use gas investigation of gas composition of the blood and investigate the level of oxygen and carbon dioxide in venous or arterial blood. And one of the methods of functional investigated or functional activity of the heart is the Vela ergometry. Several words about diseases. Acute rheumatic fever and the chronic rheumatic disease of the heart. Acute rheumatic fever is a complication of nasopharyngitis or tonsillitis caused by beta hemolytic streptococcus of group A, originating as autoimmune response to streptococcus infection. And chronic rheumatic disease of the heart is a consequence of previous acute rheumatic fever with following development of heart lesions or disorders of the joints, brain, and skin. And etiology of acute rheumatic fever is closely associated with beta hemolytic streptococcus of group A or Streptococcus pyogenes. And according to International Classification of Disease number 10, acute rheumatic fever has a code 102. And there is a Jones criteria for diagnosing the first rheumatic attack. There are major diagnostic criteria, minor diagnostic criteria, and additional criteria. The presence of two major or one major and two minor is connection with finding confirming previous infection caused by beta hemolytic streptococcus of group A suggested highly of possible acute rheumatic fever. And diseases of myocardium. It can be myocarditis, myocardial dystrophy, and cardiomyopathy. And acute myocarditis is an inflammation disease of heart with involvement of myocardium into the pathological process. Etiology of myocarditis can be different infectious agents like viruses, bacteria, protozoa, parasites, and non-infectious factors, autoimmune, allergic agencies, and toxic agencies, and others. And according to American Heart Association, there are several diagnostic criteria of myocarditis, and they are following. First of all, the disease could be associated with infection or non-infectious factors. Then sinus tachycardia, heart enlargement, weakened of the first tone, and impair of rhythm, or we can see here hollow prism. Then congestive heart failure, pathological changes in electrocardiogram reflected impairment of repolarization, rhythm, and conduction, increased activity of serum enzymes, and increased level of BNP peptide in blood. And cardiomyopathy, diseases of myocardium with unknown etiology. The main features of cardiomyopathy is cardiomegaly and heart failure. And there are two types of cardiomyopathies, primary and secondary. And major clinical manifestation of the cardiomyopathy can be D-dilated, R restrictive, and H hypertrophic. Thank you for your attention.